Now the next very important topic in ophthalmology, a squint eye. Okay, so squint, there is extraocular muscles we are going to study and biocular vision. Okay, so we are going to study basically first the squint. What is squint? So very easy, when one of the eye is deviated from its normal position. Okay, let's assume these were your two eyes and one of these eye deviated from their normal position. Okay, so this becomes like this and this is in the center. So this is a squint eye. Okay, similarly here you can see that this eye is normal but this one has deviated from its path and this is nothing but squint eye. Okay, so let us see the actions of intraocular muscles. Many muscles are there in eyes, approximately 7 or 6 muscles are there inside the eye. So totally there are 7 muscles inside your eyes and these muscles are responsible for the action and the movement of your eyes. Okay, let us study these all muscles. These are the extraocular muscle. Okay, the extraocular muscles such as levator palpebrae superioris, you might have studied these all muscles in your anatomy lectures. Then medial rectus and lateral rectus. So what is the action of levator? Elevation, palpebrae, okay, the eyelid and superior oris. So its function is elevation of the eyelid. Which eyelid? Upper eyelid. Okay, superior oris. So upper eyelid is elevated by this muscle help. Then comes your medial rectus. It is used for the inward movement or adduction of the eye. Okay, adduction means when you see on the tip of your nose, both the eyes look in a particular direction. Okay, assume this as the nose, so both the eyes are looking in this direction. This phenomena is known as adduction. Okay, and the next muscle comes is the lateral rectus muscle. It is used for the outward movement or abduction of the eye. Okay, so when this phenomena is reversed, okay, the you are seeing in a this direction, okay, this direction, so this is nothing but abduction. Okay, when you are adding both the eyes, this is adduction, and when both the eyes move in an opposite direction, this is abduction. So these were the three muscles. Now totally there are 7 muscles. So what remaining muscles are present over here? So these are superior rectus, inferior rectus, superior oblique and inferior oblique. The superior rectus, its primary action is elevation, and the inferior rectus, its primary action is depression. Okay, now there are something called as extorsion and intorsion. Okay, this is the movement of eyeball at its axis only. Okay, particularly you cannot see the extortion and intorsion of an eyeball. Okay, this is not visible by your naked eyes. So intorsion is nothing but inward movement or inward rotation of the eyeball, and extorsion is nothing but outward rotation or outward movement of the eyeball. Now comes the tertiary action of the superior rectus and inferior rectus. So the tertiary action of both the rectus is adduction. Okay, and we discuss about the adduction phenomena. This one, adduction. Now it's very simple to learn about the obliques. Why? Because the secondary action of the rectus is the primary action of the obliques. Very simple. And the primary action of the rectus, opposite to these primaries, there is the secondary action. Okay, so if here is the depression, then here would be the depression, and here is the elevation, then here would be the elevation. So opposite totally. Okay, and the same tertiary action is the same, adduction. Okay, so very simple to learn this table. Just you have to remember the rectus part, automatically you can go for the oblique part, or you can remember as the opposite of the rectus is oblique. Okay, here you can see in the diagrammatic form all the muscles over here. Okay, and you can even remember the actions of those all muscles, those 7 types of muscles, by this diagrammatic form. Okay, very simple. The superior rectus, there is a elevation and in abduction. Okay, so elevation with abduction is seen, elevation with adduction is seen with inferior oblique, and superior rectus elevation in adduction. Okay, respectively all these muscles are given in this diagram. So very easy diagram to remember all the movement of the eyeballs. Now, what is binocular single vision? So, humans have the binocular single vision because both the eyes move in a same direction at the same time. Okay, so if I have to see this object, then both the eyes at the same time would be moving towards this object. Okay, if here is the object, then both the eyes would be moving towards the object over here. Okay, so this is nothing but binocular vision. Okay, both the eyes will be moved together in a same direction, and this is due to the muscles which we studied. So what is the 3 grades of binocular vision? G1, G2 and G3. G1 is the stimulus to the macular perception. Okay, remember the macular perception. Here there is a fusion of both the images, and in grade 3 you are going to see the stereopsis. Okay, that is nothing but the depth perception. Okay, so you will be able to perceive the depth of something. Now some occurrence of the binocular single vision, how the binocular single vision occurs. So this is due to some things. These are synergism, antagonism, York muscle, or you can call it as contralateral synergism. There is a law called as Hering's law and another law called as Sherrington's law. Okay, so let us discuss these all topics respectively. What is synergism? So the pair of muscle having a same action in a same eye. Okay, so same action in a same eye, this is known as synergism. What is the example for this? So a right superior rectus and the right inferior oblique, these are the 2 pairs of muscle which has the same action in a same eye. Okay, very easy. Then comes antagonism. Okay, what is antagonism? The name itself tell us antagonism, antagonist. Okay, so opposite action would be seen over here. So the same pair of muscle but having opposite action in the same eye. Okay, for example, right superior rectus and the right inferior rectus. Okay, rectus both, so opposite action, and we studied the action previously only. Now what are York muscles? So these are the pair of muscles. Okay, one in each eye. Okay, it is one in each eye that moves the eyeball together in a same direction. Okay, together in a same direction, and this is known as visual movement or conjugated movement. Very important, students. Okay, so pair of muscle, one in the each eye, that moves the eyeball together in the same direction, and this is known as visual movement or conjugate movement. Now let us learn about some movements. The primary movement or the normal movement that you see in the front, this is known as primary gaze. Okay, now levovision is what? Moving to a particular side over here. Okay, assume that this was the object, so you are looking at this object and your eyes turn towards this direction. This is levovision. Dextrovision again in the opposite direction. Okay, then there is dextro elevation. Okay, so eyes would be a little elevated. Okay, so you are looking at this corner, okay, over here in this image, and this corner at this image. Okay, this is dextro depression and this is dextro elevation. Okay, so after dextro elevation and depression comes the levo elevation and depression. So here you can see the levo elevation. Okay, so here there would be at a corner the person would be looking at, and here there would be the object. Here the object would be superiorly. Okay, superiorly. Here the object would be inferiorly, so circumvision. Okay, and this is known as dero circumvision. This is levo depression, levo elevation. Now after synergism, antagonism and York muscles, we are going to Harring's law. What is Harring's law, students? So equal intervention of the pair of York muscles that we studied here only. Okay, so there is a equal intervention of the pair of these York muscles, and this is responsible for equal intensity and stimulation of the neural impulses. Okay, equal intensity, remember, equal intensity and stimulation of neural impulses that is needed to reach the both of the yoke muscle. Okay, so it is nothing but equal innervation of the pair of the yoke muscle. And what, how we are innervating these pair of yoke muscles? So there is a equal intensity or stimulation of nervous impulse which is going to stimulate these both yoke muscles respectively. Okay, now Hering's law does not follows the dissociation ventricle deviation. Okay, so dissociation vertical deviation, it is not followed by the Hering's law. Then comes the Shearing's law of the reciprocal inhibition. Okay, what is Shearing's law? Shearstan's law. So it is responsible for the relaxation of antagonists of York muscles. Okay, so this is responsible for stimulation and this is responsible for relaxation. Okay, very easy, both the laws, as they are opposite of each other. So that was all about our first part of squint.